Welcome back. November is Diabetes Awareness Month. The disease affects over 250,000 Arkansans and affects dental health as well. 1 in 5 cases of tooth loss is linked to diabetes. Very interesting. Dr. Bryan Dunlap of Dunlap Dental joins us with more. Really interesting to hear how diabetes and your teeth can be connected.
You know, diabetes is one of those things that are like a lot of, systemic diseases or syndromes that a lot of times will show up in the mouth. And so there have been times where, your dentist may be the first person that's actually aware that you might have signs of diabetes. A patient when he's even unaware that they had diabetes.
Wow. So what can we do? What should we be looking for?
Well, there's certain things. Obviously, a lot of people might know this, that with diabetes, things don't heal as well. And so if people might get sores and cuts in their mouth, it might not heal as well. Or they might be more prone to yeast infections, which is called candidiasis in the mouth, which kind of has a white film on your tongue and it's uncomfortable. But if, all of a sudden some people are experiencing some of these things that they're noticing, obviously a good idea to get you checked up with your dentist, but, also maybe clue you in that something else is going on that the dentist can help you figure out.
Okay, dry mouth is one of them.
Yes, that's another biggie. Dry mouth causes a whole lot of problems out there. If all of a sudden that you notice that you're having a dry mouth and it's not because you've just got on a new medication or there's not another obvious reason that that's going on, some people who go through chemotherapy might have dry mouth. If not any of those things are occurring and you're all of a sudden getting some dry mouth, that's a sign that something may be going on as well. And dry mouth also causes a lot more problems like increased cavities and things like that.
Wow. Okay, infection, another sign.
Right, yeah. Again, like we were talking about before, when you get infections, a lot easier with diabetes. And so, you're just not going to heal as well. It just slows down the process. And we have a lot of diabetic patients, and there's a lot of you out there with diabetes, and you're aware of these things. Certain oral signs that you might have diabetes also include bad breath that all of a sudden shows up. I have a lot of patients that all of a sudden out of nowhere, they've never had problems with, and all of a sudden they have bad breath. And again, if there's not a change in lifestyle or a new medication, certain things like diabetes might be the cause of that.
Wow, very interesting. And finally, gum disease. We briefly talked about that, but bleeding, those kind of issues. Yeah,
extra bleeding gums, so other signs. Again, all this kind of goes back to what we've said many times here is changes. If you are experiencing some changes in your mouth or anywhere in your body, it's a good idea to get things checked up and see, okay, why are these things changing? Why are my gums all of a sudden bleeding a lot more? Why do I have bad breath? Why do I have had these issues? And again, it's usually a sign that maybe something has changed, and let's see what's going on and treat these problems.
Okay, where can they go see you?
We're at 1515 Aldersgate Road in Little Rock off of Canis.
Go visit Dunlap Dental. Thank you for joining us. We appreciate you, and we are back with more after this. Stick around.